Okay, so here's my diabetic concept map video. First, I've got my concept map right here, and I will attach it, as well. Here's the next thing, but I'm going to use it for now. So my patient came in, she came in with pancreatic neoplasm. She actually didn't come through the ER. She was there for surgery, and then she got, admitted after. So they did the Whipple procedure on February 3rd. So when I had her, she was on hospital day 5. She has diabetes type 2, which the pathophysiology of diabetes type 2 is increased insulin resistance in fat and muscle cells. So she doesn't really have family history because she was adopted at a young age and she never knew her biological parents. So literally in her chart it said no family history due to adoption. She has a BMI of 20.75. So on her assessment, really, everything looked really good. She was alert and oriented ×4, Perla in both eyes. She was in normal sinus rhythm. Occasionally, she would jump to sinus brady, but nothing too bad. +2 in the pedal and radial pulses. S1 and S2 heard upon auscultation. She had no edema. She did have her abdomen, obviously it had just had surgery, but from what I could see there was no extra edema or anything. Less than 2 seconds on the capillary refills on her hands. So when I had her, she that morning she was NPO, but then a little bit, probably 2 hours into the day, or an hour probably into the day, the doctor came in. He put her on to start tube feeds, and he also put her on a clear liquid diet, so she got to have the clear liquid stuff. And she also got Glucerna feeding 1.5 through her J tube. It was only going at 10 milliliters per hour on the day I had her. It was for a nutritional supplement because she had been NPO for so long. And also they had taken out they took out the head of the pancreas, and so they wanted to slowly get her back into eating. It was a very big major surgery. Her breath sounds were wheezy and all lung fields. So she was on room air, but she did have some labored breathing when she got up, to go to the bathroom or to go walking or something. But her O2 sat always stayed above 93%. So she had JP drains to the right side of the abdomen, anterior and posterior. Those drained about, I think it was 75 milliliters in one, and I think it was about 50 in the other. On the day I had her, she also had the J tube on the left side, and then she had the surgical incision in the middle of her abdomen from where they did the Whipple procedure. She had a port that was accessed on her right chest from, obviously they do chemo and everything through it, but that's what they used at the hospital as well. The surgical incision was approximately 5 inches long. She was very, very weak. Her gait was balanced. She was a standby assist, to go to the bedside commode, or when she walked in the hallway, she was a standby assist. She had no abdominal distension. She really didn't have any, she had a little bit of tenderness, but that was because of the surgical procedure. Nothing from no other reason though. She had bowel sounds that were active in all 4 quadrants. Her last bowel movement when I had her was on 2/6. Patient, she was continent of urine. She peed yellow and clear urine, no odor to it. She was continent, no dysuria noted. So some important lab values that I found was her glucose trended in the mid 100s to low 100s almost the whole time. She didn't really get much insulin. So on 2/7, her glucose was 103. Her total protein on 2/7 was 5.4, which is a little bit low, but diabetes obviously affects the total protein because diabetes slows down the healing process, as which it will slow down the protein. Her albumin was 2.58. Diabetes can cause low levels in the blood for albumin. On 1/11/25, her lipase level was 10, which diabetes type 2 can lower the lipase levels due to impaired function of the pancreas. On 1/12, she had a hemoglobin A1C, which was 6.8. And obviously that shows how she manages her diabetes at home for the past 3 months. On 1/11, she also had a UA done, and the result was she did have a UTI, but she had no ketones noted in that. She didn't have any ABGs in her chart that I could find. She didn't have any like HDL or LDL either. Her GFR was 93, which diabetes affects the kidney function, and then creatinine was 0.59, which also affects the kidney function. Her med list that she was on at the hospital was atenolol 25 milligrams. She took that for hypertension. Lovenox 40 milligrams per 0.4 milliliters. She took that just because she was in the hospital. She wasn't mobile. They didn't want her to get a blood clot or anything. Famotidine, it was an IV push. She took that for acid reflux, heartburn. She had insulin glargine, which she got 10 units in the morning. That's the long-acting insulin. They do not do metformin at the hospital, so she had to be on like sliding scale and actual insulin. She was on Lasix, 10 milligrams IV to just get the fluid off of her. She was kind of in fluid overload. They said acetaminophen through the IV also because of her pain from her surgery. She had fluticasone nose spray, which was for a history of allergies. She had Dilaudid 0.5 for pain if she needed it, PRN. She had insulin, Lispro. She had the sliding scale for all meals. And then she got 3 units, additional 3 units of Lispro TID, so with all meals. At home, to manage her diabetes, though, she takes metformin, 500 milligrams BID. She's also on Januvia, 100 milligrams BID. And then she also takes Tresbia, which is an injection. She takes 30 units at bedtime. So her lifestyle, she told me that she walks a lot at home. Obviously, she can't walk as much right now because she obviously got diagnosed with cancer. So she's kind of had to take a slow on that. But she also used to ride horses before she got diagnosed with cancer, and she says she really wants to get back to doing that. Smoking, she used to smoke 1 pack a day for 55 years, but she quit 3.5 years ago. Drinking, she was a heavy drinker when she was young on like the weekends, but she doesn't drink any now. She maintains her glucose at home by taking her blood sugar 2 to 3 times a day. She reports good eating habits. She eats, vegetables, fruit. She eats 3 meals a day. She told me that they don't eat out very much, so they're eating pretty good food, home cooked food. She drinks 0 sugar drinks at home, and then she'll also have snacks also. She did report, I seen in the dietitian note that she did report she had some hypoglycemia at night, but she'll eat, if she starts to feel like she's getting low, she'll get up and she'll eat a snack or something. Her history, so she didn't, she had no neuropathy noted. In the diabetes educator note, it specifically said no neuropathy noted, no nephropathy noted, no ulcers. She's never had any ulcers or anything. Her last dilated eye exam was January 2025, but no reports of retinopathy. But she is seeing an eye doctor, which is good. So the nursing diagnoses and the goals for like each one that I had, I did risk for infection related to broken skin as evidenced by surgical incision on midline. So the goal would be Patient will have no signs and symptoms of infection at the end of discharge. That was ranked number 2 on my nursing diagnosis out of the 3. My first nursing diagnosis that I ranked number 1 was imbalanced nutrition, less than body requirements related to side effects of treatment, as evidenced by patient is on chemo for pancreatic cancer. Her goal, patient will eat 3 adequate meals per day before end of discharge, because like I said, when she was in the hospital, she wasn't getting 3 meals a day. She had been NPO, and then they put her on tube feedings, so she hadn't been getting 3 meals a day. So that's why I used that one as number 1. And then the last one I put for number 3, I put risk for hyperglycemia related to diabetes type 2, as evidenced by hemoglobin A1C is 6.8. The goal I put, patient's hemoglobin A1C will drop to 6.0 by the 3-month post-discharge follow-up appointment. Interventions that I used, I had 4 of them. The first one was patient gets a protein shake for each meal to help with wound healing, which the outcome could be total protein is 7.5 at the next follow-up appointment. Number 2, I put patient washes hands multiple times a day to not get any viruses, bacteria, or infections. Outcome, patient tests negative for all viruses, bacteria, all of that stuff. Number 3, I put weigh patient daily to monitor for inadequate nutrition. Outcome, I put patient's BMI remains between 18.5 and 24.9. And then number 4, I put check blood sugar, ACHS at home to monitor glucose. Outcome, blood sugar remains between 70 and 110. So I think I had said earlier she only checks her sugar 2 to 3 times a day, so maybe she checks it like they do in the hospital, ACHS, before every meal and before bedtime. So my evaluation on her, I feel like when she came to the hospital, obviously she came to get the Whipple procedure done. I feel like when I had her, she was doing very well for having that big surgery. She's done really good recovering. When I was there, she got no Dilaudid. She did get the IV Tylenol, 1 bag of it when I was there. And her blood sugar remained really well when I was there also. So I feel like she's really has done pretty well. The patient's surgical wound has improved since they did the surgery. There's no signs or symptoms of infection. The doctor had even said it's looking really well. And I overall think she is improving very, very well. And yeah, that's all for my concept map. Thank you.